You are listening to the Pregnancy Podcast with Vanessa Merton. Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about what the evidence says about exercise during pregnancy. Recommendations for working out when you're pregnant can be very confusing, especially when advice feels restrictive, outdated, or inconsistent. I do not want you feeling afraid to work out. In this episode, we'll look at the evidence to actually clarify what matters. You will learn how pregnancy-related changes can affect your workouts and how to adapt your activity safely and confidently. I'll cover warning signs to watch for, activities that do require some extra caution, and how current guidelines compare with the research. You can find the full article and all of the resources that accompany this episode at pregnancypodcast.com/exercise. You are on the public feed of the podcast. Get ad-free access to every single episode when you become a Pregnancy Podcast Premium member. That includes hundreds of episodes with evidence-based information that you won't find anywhere else. Check it out at pregnancypodcast.com/premium. The VTech V-Hush stroller rocker gently rocks your baby's stroller or crib, which helps them sleep peacefully wherever you are. With a rechargeable battery, an amber nightlight, and calming sounds, you can soothe your baby to sleep anywhere. Save 20% with the code VTPodcast20 and check it out at pregnancypodcast.com/stroller rocker. Zoller goes above and beyond in formulating their prenatal plus DHA. It's made with high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In the month of January 2026, save 40% on the Zoller Prenatal Plus DHA Vitamin on Amazon with the code ZAPREN40. You can always check for the current promo code at pregnancypodcast.com/vitamin. 8 Sheep Organics makes amazing 100% clean, natural pregnancy products. From skincare to treating common symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics has you covered. Every product comes with a 100-day happiness guarantee. Try it risk-free, and if you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. We all know that exercise supports your health, both in the short and long term, and those benefits do not stop during pregnancy. Regular exercise during pregnancy can lower your risk of complications like gestational diabetes, preeclampsia, and cesarean birth, and help support a healthy weight gain. It can also help with common pregnancy symptoms like constipation and back pain. Sleep is another area that exercise has a very meaningful impact. Research shows a strong relationship between sleep and exercise. Exercise can help you sleep, and high-quality sleep can help you recover better and get more out of your workouts. A systematic review and meta-analysis found that pregnant women who exercised regularly had significantly improved sleep quality. Timing does matter. To support sleep, aim to finish your workout at least 2 to 3 hours before bedtime. Exercise can also support stress management. It may seem counterintuitive that physical stress can actually help reduce psychological stress. Exercise influences hormones involved in the stress response and may help ease symptoms linked to chronic stress, including cardiovascular strain and impaired immune function. One challenge is that research shows stress can make it harder to stay active. The more stress you feel, the less motivated you may be to move your body, and that can create a negative feedback loop. One way to interrupt that pattern is to make exercise a habit, even if that means scaling back and keeping it simple on stressful days. This episode provides an overview of exercise during pregnancy, and more episodes will follow that go in depth on specific types of exercise, including cardio, strength training, and yoga. But today's episode is the foundation of what you need to know. As you learn about different aspects of pregnancy, it can be helpful to understand where recommendations come from and how your doctor or midwife may be thinking about them. I often reference guidance from the American College of Obstetricians and Gynecologists, and that's because their recommendations guide most hospitals and obstetric providers. ACOG bases its guidelines on available evidence, but they are designed to apply broadly to all pregnant women, including those with complications. As a result, the recommendations tend to be very conservative. ACOG recommends that pregnant women aim for at least 150 minutes of moderate intensity aerobic activity every week. They define moderate intensity as an activity that uses large muscle groups in a rhythmic way and raises your heart rate and breathing. You should be able to talk during the activity, but not sing. Moderate intensity exercise can include a wide range of activities, from a brisk walk to everyday movements like gardening. One of the most critical mindset shifts during pregnancy is moving away from performance-based metrics and toward relative effort. Your heart rate, breathing, and perceived exertion may change even if you're doing the same workout that you did pre-pregnancy. Blood volume increases, lung capacity decreases, and your body is working harder overall. It's normal to feel winded sooner or to notice that your pace, your routine, or your weights change. This does not automatically mean that exercise is unsafe. It means that your body is adapting. Tools like the talk test, remember that's when you're able to talk but you wouldn't be able to sing, and perceived exertion are more helpful than heart rate targets or pace goals during pregnancy. If something feels unsustainable, overly exhausting, or uncomfortable, that is valuable information. The goal during pregnancy is not to be hitting PRs. The goal is to stay active in a way that supports your health and that adapts to the changes that are happening in your body. Many recommendations about exercise during pregnancy err on the side of caution. And that's important to understand because this will help explain why advice can sometimes feel restrictive or even inconsistent. Pregnant women are often excluded from research studies, especially women with higher risk pregnancies. A lack of evidence doesn't automatically mean that something is unsafe. In most cases, it means we simply do not have high-quality data. Medical organizations like ACOG are creating guidelines intended to apply to the broadest possible population, including mothers with complications or limited access to individualized care. For these reasons, recommendations are often conservative. This is why you may hear blanket advice like don't lift heavy weights, avoid lying on your back, never let your heart rate get too high. When you look more closely at the research, many of these concerns are theoretical and based on older assumptions rather than strong evidence of harm. Given all of this, it doesn't mean that you should ignore guidance. It means that safety during pregnancy is often about context. Your experience level, how your body feels, and any pregnancy complications matter. The goal in this episode is to help you understand the evidence so that you can make informed decisions rather than feeling afraid to work out. Over the years, ACOG has shifted how it frames precautions around exercise during pregnancy. In the past, they listed a lot of contraindications. Now, their guidance emphasizes that if you are healthy and your pregnancy is normal, it is safe to continue or start regular physical activity. ACOG also notes that it is important to discuss exercise with your OBGYN during your prenatal visits, and if your OBGYN gives you the okay to exercise, you can discuss what activities you can do safely. Beyond specific medical risk scenarios, many of the same precautions that you would follow for any time in your life when you're working out still apply. That said, some of the pregnancy exercise recommendations are intentionally conservative. And for some expecting moms, this creates fear around doing anything that carries even a minimal risk. ACOG identifies specific activities that should be avoided during pregnancy, and these are due to a higher risk of injury. That includes contact sports or activities that pose a risk of abdominal injury, like ice hockey, boxing, soccer, and basketball. They also recommend avoiding activities with a higher risk of falling, including downhill skiing, water skiing, surfing, off-road cycling, gymnastics, and horseback riding. ACOG also cautions against hot yoga and hot Pilates because of the risk of overheating. Additional activities to avoid include exercising at altitudes above 6,000 feet if you do not already live at a high altitude, also skydiving and scuba diving. It's worth noting that many recreational activity providers, think ziplining, renting ATVs, restrict participation during pregnancy for liability reasons, even if the activity might otherwise be considered low risk. So these policies are often based more on insurance and liability rather than actual evidence of harm. There are some warning signs that indicate that you should stop exercising. And spoiler alert, these are very obvious. The list from ACOG includes regular painful contractions of the uterus, bleeding, fluid gushing or leaking from the vagina. Other warning signs include feeling dizzy or faint, shortness of breath before starting exercise, chest pain, headache, muscle weakness, calf pain, or swelling. Paying attention to how your body feels is really the key to keeping exercise within safe limits. For most pregnant women, exercise is safe and beneficial. If you feel excessively fatigued, overly winded, or uncomfortable, that is a signal to slow down or to stop. Maintaining or starting an exercise routine during pregnancy can be really helpful, and it's just as important to rest when your body needs it. Pushing yourself beyond your limits will increase the risk of injury and other complications. Bottom line here, if you feel like you may be overdoing it, that feeling is worth listening to. Your experience with exercise before pregnancy will play a vital role in how you approach this during your pregnancy. There's a big difference between someone who is new to exercise and someone with a very active lifestyle. According to ACOG, if you were very active before pregnancy, you can keep doing the same workouts with your OBGYN's approval. They also note that if increased activity leads to weight loss, you may need to increase your calorie intake. On the other hand, if exercise is not currently part of your routine, it's never too late to start. ACOG recommends beginning with as little as 5 minutes of activity a day and gradually increasing by about 5 minutes each week until you can stay active for about 30 minutes a day. Now that we've covered a lot of the general guidelines and some background info, let's talk about the physical changes that happen during pregnancy that can impact your exercise. Many of the physical changes you experience can affect how exercise feels and how much energy you have. And these changes can influence your motivation, your comfort, your performance, and they can vary from one expecting mother to the next and may also vary across different stages of your pregnancy. These changes do not mean that you should avoid exercise, but they will help explain why movement may feel different and why adjusting intensity, duration, or type of exercise may be appropriate. First up is fatigue. This is very common during pregnancy, especially in the first and third trimesters. A lot of things drive this, including increased progesterone levels, expanded blood volume, lower blood pressure, higher metabolic demands, and changes in your blood sugar regulation. All of these processes require energy, and that can leave you feeling more tired than usual. If you experience fatigue, rest is important. That may mean taking a nap, going to bed earlier. It could mean shortening a workout, skipping exercise altogether for a day or two. Fatigue is not a sign that you're doing anything wrong. It is a normal part of pregnancy, and you may need to adjust your activity level to match your energy. Another big one is morning sickness. This is, of course, nausea with or without vomiting that happens during pregnancy. Despite the name, it's not just in the morning. It can happen at any time of day. Morning sickness affects 60 to 80% of pregnant women, and it's most common in the first trimester. Symptoms can start as early as 1 to 2 weeks after conception, but they do often improve after about the 12-week mark. When you're not feeling well, morning sickness can significantly affect your motivation and your ability to exercise. If there is a time of day when symptoms are milder, I would try scheduling activity during that window. It's also very reasonable to scale back or even pause exercise altogether until symptoms improve. If you're dealing with morning sickness, hang in there and know that this is temporary. A big physical change that will happen during pregnancy is weight gain. Not only is this expected, it is necessary. For someone with a normal pre-pregnancy body mass index, the general guideline is total weight gain of about 25 to 35 pounds over 9 months. That's about 11 to 16 kilograms. In reality, half of all pregnant women gain more than the recommended range. Regardless of where you fall within these guidelines, additional weight gain does place increased strain on your joints, muscles, and your feet. That can affect how exercise feels and may require adjustments to the type, intensity, or duration. As your pregnancy progresses, much of the weight that you gain is concentrated in your abdomen, and that shifts your center of gravity. This can affect your balance and make you more prone to instability or falls. A shifted center of gravity can also alter the way you walk and how pressure is distributed across your legs and feet. Another physical change that you will notice is changes to your breasts. And tenderness is very common during pregnancy, particularly early on. Most women will notice that their breasts increase in size beginning in the first trimester. That happens as the ducts and alveoli rapidly multiply in preparation for breastfeeding. These changes can make your breasts more sensitive during movement, and as they grow and become more sensitive, you may need additional support during exercise. Wearing a well-fitting, supportive sports bra can make activities more comfortable, and you may need to change sizes as your pregnancy progresses. Another influence on workouts are changes to your cardiovascular system. During pregnancy, your blood volume increases by about 50%, and that's required to support your growing baby and the placenta. This added volume requires that your heart works harder, and that can cause your heart rate to rise more quickly during exercise. Even at rest, heart rate tends to be higher during pregnancy. Because of these changes, activities that once felt easy may feel more challenging. If you notice that your heart rate feels uncomfortably high or you feel overly winded, that is your signal to slow down or take a break. Using cues like how you feel and whether you can comfortably carry a conversation may be more helpful than focusing on specific heart rate numbers. As your pregnancy progresses and as your uterus grows, it will push upward on surrounding organs, resulting in reduced lung capacity. This can make breathing feel more difficult. It can leave you short of breath, particularly during cardio-focused activities. Reduced lung capacity is not a reason to avoid exercise, but it is something to be aware of. Your oxygen levels directly influence your baby's oxygen supply. So feeling winded is a cue to slow down and allow your breathing to recover. Another important physical change that you need to be aware of is relaxin. Relaxin is a hormone that increases during pregnancy and helps loosen ligaments in preparation for labor and birth. The downside is that relaxin does not act only on the pelvis and hips right before your baby is born. Relaxin will affect ligaments throughout your body for the duration of your pregnancy. Ligaments provide joint stability, so increased laxity can raise the risk of injury, particularly during movements that involve rapid direction changes, deep stretching, or heavy lifting. Being mindful of joint stability and avoiding movements that push beyond a comfortable range can help reduce your injury risk. There's a few more pregnancy-related physical changes to cover before we get into some other topics regarding safety of exercise during pregnancy. Before we cover that, I would like to thank the sponsors that have supported today's episode. A lot of companies offer exclusive discounts for pregnancy podcast listeners, and you can always see all of the discounts and promo codes at pregnancypodcast.com/resources. VTech is the #1 baby monitor brand in North America. They build innovative products to make your parenting journey easier. One of their newest innovations is the VTech V-Hush stroller rocker. This is a portable device that uses a gentle mechanical rocking motion to soothe your baby to sleep. This can be attached to a stroller so you can help your baby sleep on the go, or to your crib at home. It has 3 adjustable motion levels, so you can choose the perfect speed to calm your baby. VTech also packed in thoughtful details like a built-in amber nightlight, a rechargeable battery, soothing sounds, white noise, and lullabies. Soothe your baby to sleep anywhere with the VTech V-Hush stroller rocker. Save 20% with the code VTPodcast20 and check it out at pregnancypodcast.com/stroller rocker. Not all prenatal vitamins are created equal. Zoller goes above and beyond, using the latest scientific research to formulate their prenatal plus DHA with high-quality bioavailable ingredients. The Zoller Prenatal Plus DHA is sourced directly from nature, containing pure, unadulterated ingredients to meet the highest standards. This vitamin is carefully formulated with the nutrients that you and your baby require in the optimal ratios for absorption, metabolism, and safety. One of my favorite things about the Zoller Prenatal is that it contains omega-3s like DHA. Very few vitamins include this ingredient, and your DHA levels directly impact the central nervous system and the cognition of your developing baby. With 300 milligrams of DHA included, this is one less thing you need to think about. In the month of January 2026, save 40% off the Zoller Prenatal Plus DHA on Amazon with the code ZAPREN40. You can always check for the current promo code at pregnancypodcast.com/vitamin. Let's get back to today's episode. Swelling during pregnancy is referred to as edema. This is common and results from several normal physiological changes. Blood volume and fluid levels increase significantly. As your uterus grows, it places pressure on blood vessels in the pelvis and the legs that can actually slow circulation and cause fluid to pool in the lower extremities. Hormonal changes can also soften the walls of veins, which make them less efficient at returning blood to the heart. Swelling is most common in the third trimester. It may be accompanied by numbness, tingling, or aching in the legs and feet. While swelling can be uncomfortable, there's simple adjustments that can help reduce it. One study found that exercising in a pool was associated with decreased swelling during pregnancy. If this is something that you are experiencing, one of the best things that you can do is take a break and prop up your feet. Another place that fluid can build up is in your wrists. When this happens, it can compress the median nerve, leading to tingling, numbness, or pain in the hands. This can result in carpal tunnel syndrome that can affect grip strength and make specific movements uncomfortable. One study estimated the prevalence of carpal tunnel syndrome during pregnancy to be about 34%. And this is more common in the second and third trimesters as swelling increases. If your exercise routine involves gripping weights, bars, or other equipment, carpal tunnel symptoms can make these activities more challenging. Modifying exercises, reducing the grip demands, or taking breaks as needed can help you continue your workouts while minimizing discomfort. It's essential to address breath, core, and pelvic floor function because these all apply to movement during pregnancy. And when I talk about the core during pregnancy, I'm not just talking about abs. In addition to your abdominal muscles, your core includes your diaphragm, back muscles, and your pelvic floor. These muscles work together to manage pressure inside your body and support movement. Breathing plays a central role in this system. Holding your breath or constantly clenching your abdominal or pelvic floor muscles can actually increase pressure in ways that are not helpful, especially as your uterus grows. On the other hand, coordinating between your breath and your movement can help support your spine, reduce strain, and make exercise feel more comfortable. This doesn't mean that you need to overthink breathing or continuously control every breath. It means that you should avoid prolonged breath holding, avoiding constant tightening, and pay attention to how your body responds. You may have heard that you should never lie on your back during pregnancy, especially after the first trimester. This advice comes from concerns about pressure on the vena cava. This is a large vein that returns blood from the lower half of your body back to your heart. Compression of this vein could reduce blood flow and oxygen to your baby. When researchers have looked at this more closely, the evidence is less clear than you would expect. Systematic reviews have found that recommendations to avoid exercises on your back, also referred to as supine exercises, are largely based on expert opinion rather than strong evidence of harm. And short periods of exercise or rest on your back are not associated with adverse pregnancy outcomes. There's a difference between lying flat on your back for very long periods and being flat on your back in a supine position for brief periods during an exercise or a stretch. Your comfort and any symptoms that you experience matter. If you feel lightheaded, nauseated, if you're short of breath, if you're uncomfortable while you're on your back, that's a signal to change positions. Many exercises can also be modified so that rather than being flat on your back, perhaps you can do it at an incline. You may try alternating positions or limiting the time that you're spending on your back. Now that you understand the exercise recommendations and how pregnancy-related changes can affect your workouts, there's a few other things to consider. The first is hydration. During pregnancy, your fluid needs increase. You need additional water to support digestion and nutrient transport, to produce amniotic fluid, to increase your blood volume. Plus, you lose more water when you're pregnant through increased urination and respiration. Plus, all of those hormonal and metabolic changes further raise your fluid needs. The American College of Obstetricians and Gynecologists recommends drinking 64 to 96 ounces. That's about 2 to 3 liters of water each day during pregnancy. If you are exercising, you need additional fluids to replace those that you lose through sweating. Your body provides clear signals when you're not getting enough fluids. Thirst or a dry mouth is an early sign that you need to drink more. Other signs of inadequate hydration include urinating less frequently, headaches, fatigue, and dizziness. According to ACOG, you should contact your care provider if you experience signs of more significant dehydration. This would include very small amounts of dark-colored urine, inability to urinate, difficulty keeping down liquids, dizziness or fainting when standing, or a racing or pounding heartbeat. The simplest way to assess hydration is by paying attention to the color of your urine. Research shows that urine color is a valid marker of hydration status in pregnant women, and your urine should be a pale yellow. If it's darker than that, you should be drinking more water. You may also consider adding electrolytes. Electrolytes include sodium, potassium, calcium, magnesium, and chloride. These play essential roles in muscle contraction, nerve signaling, fluid balance, and maintaining proper pH levels. You get electrolytes from foods and beverages that you consume, and then you lose electrolytes when you sweat and eliminate fluids. Of course, you are sweating if you are working out, which makes replacing electrolytes even more important. Not only can this help support hydration and muscle function, it may also help reduce fatigue or cramping. You also need to consider calorie needs. These are based on a lot of factors: age, sex, activity level, pregnancy status. A common baseline for adults is about 2,000 calories per day. According to ACOG, if you were pregnant with a single baby, no additional calories are typically needed in the first trimester. In the second trimester, calorie needs increase by about 340 calories per day, and in the third trimester by about 450 calories per day. These are general estimates, and they may need to be adjusted based on your activity level. If you are working out, you need calories to fuel those workouts. Weather permitting in your area and the time of year it is, exercising outdoors can give additional benefits beyond just physical movement. Natural sunlight can help your body produce vitamin D, and exposure to light at certain times of day can help support your circadian rhythm and hormone regulation. Being outside also gets you fresh air, a change of scenery, and that can be motivating to get you moving. Also, remember that many everyday activities count as exercise. ACOG recognizes gardening, including raking, weeding, and digging, as a form of physical activity. If you do choose to exercise outdoors, you should be mindful of temperature, sun exposure, and, of course, staying hydrated during warmer conditions. Both physical activity and exposure to hot weather can increase your risk of overheating, and when they're combined, they require additional caution. Elevated core body temperature in early pregnancy has been associated with increased risk of neural tube defects and pregnancy loss, and exposure to extreme heat later in pregnancy has been linked in some studies to outcomes like stillbirth and lower birth weight. If you live in a hot climate, or if you are exercising during warmer weather, it's essential that you take steps to reduce the risk of heat exposure. It can be helpful to plan outdoor workouts for early in the morning or in the evening when temperatures are cooler. On especially hot days, you may need to exercise indoors in a temperature-controlled environment. Also, staying well hydrated, taking breaks, and paying attention to how your body feels are all important. Another thing to be mindful of if you are working out outdoors is sun exposure. A review found that exposure to UV radiation in the first trimester was associated with beneficial effects on fetal growth and blood pressure during pregnancy. Plus, sunlight supports vitamin D production and can positively affect your mood. While there are lots of benefits, your skin does tend to be more sensitive during pregnancy. And sun exposure can worsen common skin changes like melasma, and areas of stretched skin may be more prone to irritation. Because of increased sensitivity, sun protection is more important. You can wear a hat, you can choose clothing that covers exposed skin, you can seek out shade if that's a possibility. The American Academy of Dermatology advises using a broad spectrum sunscreen with an SPF of at least 30, which blocks about 97% of UVB rays. You should apply sunscreen every 2 hours or sooner if you go swimming or if you are sweating. If this is your first pregnancy, your regular clothes will often fit through about the first trimester. Around weeks 12-13, many expecting moms notice that their clothing feels tighter and less comfortable. If this is not your first pregnancy, or if you are expecting twins or multiples, you may notice these changes earlier. Depending on the type of exercise that you do, maternity workout clothing, especially bottoms, can improve comfort and reduce restriction as your body is changing. Another consideration is sports bras. Breast size can continue to change throughout your pregnancy. You'll likely see your breasts get bigger in the first trimester, but don't stock up on all new bras at that point because your breasts will continue to grow. So you may need bigger sizes later on. If you need additional support for your breasts during workouts, try wearing 2 sports bras at once. This is simple, it's very effective. Point being, there are ways to adapt your workout clothing at any price point. The goal is to stay comfortable with the resources that you have. One topic I want to touch on briefly in this episode is exercise and naturally inducing labor. Activities like walking or stair climbing are often suggested because being upright allows gravity to help your baby move lower into the pelvis. Walking may increase pressure on the cervix as your baby's descending. Remember, your cervix needs to dilate and efface. Climbing stairs requires greater hip and leg movement, which could theoretically increase that pressure on the cervix compared to just walking on flat ground. While stair climbing, going for a walk, if you are trying to induce labor, doesn't really have a downside, there's no strong evidence showing that any specific type of exercise directly causes labor to begin. In one study, mothers were asked whether they believed anything triggered the start of their labor. About 32% reported physical activity, and most commonly on that list was walking. This episode is intended as a general introduction to exercise during pregnancy. And there are many different ways to move your body, and not one single type of exercise is ideal for everyone. Different activities place different demands on your body. They have different benefits. The best exercise is the one that you will do, and hopefully one that you will enjoy. Cardio supports your heart health, circulation, and endurance. Strength training supports posture, joint stability, and your ability to handle the physical demands of pregnancy and daily life. Yoga supports mobility, balance, body awareness, and stress regulation. No one type of exercise is inherently better than another, and you'll get the most benefit from incorporating a mix of activities over time. Your routine does not need to be the same every single week. Some weeks may include mostly walking or other gentle cardio. You may have weeks that are more strength training or yoga. What matters most is choosing a movement that you can sustain and then adjusting it as your body and your pregnancy progress. There will be more episodes coming that take a closer look at cardio, strength training, and yoga so that you have more information to make confident choices. It is important to discuss your exercise and activity with your doctor or midwife. They can take into account your experience level and the specifics of your pregnancy. Keep in mind that general exercise recommendations during pregnancy are intended to apply broadly, and they are generally conservative. Plus, unfortunately, many care providers receive limited formal education in exercise. One study found that more than half of physicians trained in the United States received no formal education in physical activity. Even for providers who are knowledgeable about exercise, it can be challenging to have any kind of detailed conversation during a prenatal appointment that is only designed to last about 15 minutes. If your care provider has reservations about workouts that you feel comfortable doing, take the time to talk through their concerns and ask for clarification. Understanding the reasoning behind their guidance can help you make informed decisions. If you are not currently very active and your care provider is encouraging you to start exercising, start slow. Begin with just a few minutes a day. That's enough to start building consistency. Whether you are an experienced athlete or completely new to exercise, almost any activity can be modified to support your body during pregnancy. To recap today's episode, we covered everything you could possibly need to know about exercising during pregnancy. I touched on the benefits, what the recommendations are from organizations like ACOG. We talked about why relative effort matters more than performance. Pregnancy is not the time to be hitting PRs. I covered all of the reasons as to why pregnancy exercise advice can feel very conservative or restrictive. I went through precautions for exercise, warning signs to stop exercising. Then we went through all of the physical changes during pregnancy that can impact your exercise. This was a long list: fatigue, morning sickness, weight gain. We also talked about changes to your cardiovascular system and lung capacity, how relaxin can relax your joints and leave you more susceptible to injury. I also briefly touched on breath, your core and your pelvic floor, and supine positioning or lying on your back. Then I covered exercise and hydration, things to consider if you are working out outdoors. I touched on getting comfortable workout clothing for pregnancy, whether or not exercise can actually naturally induce labor, and how different types of exercise fit together. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. If you have a friend who's pregnant, please share this episode. So many listeners discover the podcast through recommendations, and I appreciate your sharing. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/exercise. If you're looking for more evidence-based information, or you just want an ad-free experience, become a Pregnancy Podcast Premium member. You'll never hear another advertisement, and you'll get access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.